Hey guys, Tony Maritato here. Welcome to the group. In today's video, I'm going to be answering the question, how do you rehab your knee after a total knee replacement when you don't have an ACL, an anterior cruciate ligament? But before I answer that question, if you're watching this on YouTube, this is part of a closed Facebook group. If you want to join the Facebook group, it's called the Total Knee Replacement Support Group 2018 and 19. I put a link to the Facebook group in the description of this video. Also, if you're watching this video, please take a moment, hit the subscription, subscribe to the channel, and ring the notification bell. This way you're notified when we release new content. Now let's get back to the question. So during the traditional total knee replacement, the top of the tibia, the bottom of the femur are removed, the implant is put in place, and the ACL and PCL, those two ligaments that crisscross inside the knee, are removed. There are new procedures and new implants coming out that try to preserve some of those ligaments. But let's talk about the situation and the question at hand, which is, if the ACL is removed, how is the patient supposed to return to full function? Well, there are hundreds of thousands of people who have fully torn, ruptured ACLs and function totally normal. In fact, most young adults who rupture an ACL during typically a non-contact injury, let's say they're playing soccer or basketball or football as an adult, they rupture an ACL, they're not involved in a collision with anyone. It's typically a quick change of direction, a quick deceleration. In fact, my poor nephew, it's his last year at college, ruptured his second ACL. He ruptured his first one as a freshman. Now he ruptured his second one. He's starting rehab literally in about a month. His surgery is scheduled about 3 weeks from now. So I've had the opportunity to work with quite a lot of both young athletes who have had an ACL reconstruction, as well as young adults, middle-aged adults who have opted not to have their ACL repaired. And the reality is, while this question is probably more appropriate for the orthopedic surgeon who will tell you about the specific implant they're using and the specific procedure they're using for your surgery, I can tell you that in general, unless you are performing some pretty high-level athletic maneuvers, unless you're changing body direction, running, jumping, stopping as quickly as you can from a fast-paced run, the ACL really doesn't play too much of a role for most normal adult function. You can still jog, you can still be active, that's a whole different set of questions for patients who have had knee replacements, but I can tell you that in general, when you think about the way the ACL functions, its role, what the knee does, I've covered this in a little bit more detail in other videos, but basically, so when you think of the structures, right, and you think of the upper thigh bone, the bone that comes down from the hip down to the knee, that's your femur, and kind of it's shaped with more of a ball on the end, and then you think of your tibia, which is the lower leg bone, the shin bone, it's kind of the cup and it sits on the bottom. So this would be vertical, but I don't have the mobility to show you exactly. In a typical situation, not talking about a knee replacement, when an athlete ruptures an ACL, essentially what happens is that tibia, the lower leg bone, moves in front of the femur. And the ACL prevents that anterior translation. Well, there's other structures involved that prevent that anterior translation. The joint capsule, the major structure around the entire joint, the bag that holds everything together, that is probably the main driver of maintaining that knee stability. So during your procedure, they cut open that joint capsule, they cut open that bag, but then after your procedure, when they're sewing you back up, this is kind of a trade-off, right? A lot of patients get frustrated because they don't have the easy range of motion that they used to have, and they're frustrated because they're working so hard to gain flexion. But the reality is, if the surgeon sews you up a little bit tighter than normal, cinches that joint capsule up a little tighter than normal, you have more stability. So there's no need for the ACL because the joint capsule and other ligamentous structures, connective tissue, scar tissue, you know, we always say scar tissue is a bad thing and we vilify it. But the reality is scar tissue is there for a reason, and it's providing you with support to do the things you want to do. In my opinion, now, I'm not in your shoes. I didn't have a knee replacement. I don't mean to speak out of turn, but from a purely clinical perspective, I'd rather somebody have a joint that's too tight than a joint that's too loose, because there's far more challenge with a joint that's too loose than a joint that's too tight. Too tight, you might not be able to do a couple things. Too loose, you could actually damage some stuff, you know? So I think the trade-off there is I'd rather be on the tighter side. And the reason why conventional procedures eliminate the ACL, PCL, you really don't need them for the vast majority of people who are getting their knees replaced. And I can tell you that in my experience, and this is just one little therapist in one little town, I've never seen any complications post-surgery because somebody didn't have their ACL, PCL. So guys, I hope that kind of answers your question. Your stability comes from the other surrounding structures. And while it might be frustrating to you that you're not getting 120, 30, you know, plus degrees of flexion, that lack of mobility provides you with stability, which is inherently important and vital, okay? So guys, as always, if you haven't yet, please take a minute, subscribe to the channel, turn on the notification bell so that you're notified when we release new videos. My ultimate goal is to help you experience the best possible outcome after your total knee replacement, and not just meet, but actually exceed the goals and the expectations you had before you had this surgery. Guys, as always, thank you so much, and I'll catch you in the next video.